One of the most common reasons people get referred to physical therapy is because of pain. Pain has many different characteristics. We can have acute pain, which tends to be more sharp and generally shows up immediately after an injury, or we can have chronic pain, which tends to be more dull and achy. One of the tools we use to handle either chronic or acute pain is electrical stimulation. We refer to this type of electrical stimulation as transcutaneous electrical nerve stimulation, or TENS. Managing a patient's pain can make other therapeutic activities more effective. So let's look a little closer at TENS. We'll talk about the differences between high frequency and low frequency TENS, talk about proper pad placement and choice, review the parameters for each type of TENS, and we'll demonstrate how to apply TENS properly. The main difference between these two types of TENS is the mechanism they use to help decrease the pain. One theory on how we modulate pain is through a pain gate. This theory states that whether pain is transmitted is determined by the relative amounts of excitatory input and inhibitory input at the spinal cord level. If the amount of excitatory input is greater than the inhibitory input, our pain message is transmitted. If the level of inhibitory input is greater than the excitatory input, then that pain transmission is blocked. One of the components that leads to increased inhibitory input is stimulation of our peripheral sensory neurons. High-frequency TENS uses the gate control theory to modulate pain level. It uses stimulation of the peripheral sensory neurons to help increase the amount of inhibitory input sent to the spinal cord. The addition of inhibitory input helps modulate or decrease the pain level. Low-frequency TENS uses motor level stimulation that is uncomfortable for the patient. The noxious stimuli triggers the body to release its natural painkillers. The release of opiopeptins then helps modulate the level of pain the patient is perceiving. High-frequency TENS is more comfortable, but only provides relief from pain while the stimulation is running. Low-frequency TENS is less comfortable, however the pain-reducing effects can last for several hours after treatment. The choice of waveforms for high-frequency TENS includes symmetric biphasic, an interferential waveform, or a premodulated waveform. The largest difference is with symmetric biphasic, the frequency stays constant. With IFC and premodulated waveforms, the frequency varies. The primary benefit of having a frequency that sweeps is that there's a lower chance the patient will accommodate to the electrical stimulation. For all three, the intensity is set so that the tingle is strong but comfortable. The primary waveform chosen for low-frequency TENS is the biphasic. For this protocol, we're looking for a motor level stimulation and a twitch response in the muscle. The belief is that this uncomfortable stimulus will trigger the body to release its own natural opiopeptides. The major benefit of low-frequency TENS is that pain relief can last several hours after the treatment is concluded. Typically, low-frequency TENS is only used for chronic pain management. E-stim electrodes should be placed directly over the area where the pain is. It is important to remember that the smaller the pad, the higher the current density and the more intense the electrical stimulation. For one-channel setups, the most important feature is to make sure the pads are not close enough to touch. For two-channel or four-pad setups, electrode orientation is much more important. If you're setting up electrodes for use with an interferential current, the electrodes from each channel must be on a diagonal pattern and intersect with each other. Without the pads intersecting, you lose the benefit of setting up the interferential current. If you're setting up two channels of biphasic, you want to think about whether you'd like to have control over the upper pads and lower pads, or the left side and the right side. With low-frequency TENS, you want to place the pads over the painful area and if possible near a motor point. Because we're going for motor level stimulation, the choice of a smaller pad for a treatment area may be more beneficial. You can refer to a chart of the major motor points of the body as a starting point. However, patient response should be the ultimate factor in determining the final pad placement. For safety purposes, it's helpful to ensure the patient has normal sensation in the area that's going to be treated. You can confirm this by checking in the patient's chart or performing a quick sensation screening test before treatment.
I need to test your sensation. I'm going to do that by touching your back gently. You're going to tell me if you feel it on the first time or the second time. Is it okay if I lift your shirt?
Yep.
1 or 2?
2.
1 or 2?
1.
1 or 2?
1.
Great.
For both protocols, it's imperative that the electrodes are firmly attached to the patient and that there's no chance for the pad to become dislodged while the current is running. If you choose to use interferential or pre-modulated waveforms, the parameters are predetermined. If you use symmetric biphasic, here are some guidelines. Frequency should range between 75 and 150 Hz. The optimal range for pulse duration is between 80 and 100 microseconds. As you can see on the chart, this gives us the highest probability of stimulating our sensory fibers without getting a motor response. The intensity should be turned up so that the patient feels a strong but comfortable tingle, and the E-stim should run continuously. If the patient's receiving E-stim in the facility, typical treatment times run from 10 to 20 minutes. The parameters for low-frequency TENS are quite different. The frequency should be set somewhere between 1 and 5 Hz. Keep in mind we're looking for a muscle twitch only and not a tetanic contraction. The higher the frequency, the greater the chances we're going to have summation and lose our twitch response. Pulse duration is in the 2 to 300 microsecond range. This longer duration allows us to achieve a motor response at a lower intensity. The intensity is set to create a strong muscle twitch, and the E-stim is cycled on and off at a 1 to 3 ratio. Treatment duration ranges from 20 to 45 minutes. Here's a demonstration on how to initiate high-frequency and low-frequency TENS treatment.
I'm going to start turning up the intensity. Let me know when you start to feel it tingling.
I'm starting to feel it.
Okay, I'm going to turn it up until it's strong but still comfortable. So let me know.
Right there.
That feels good there. It's strong but comfortable?
Yeah.
Okay, we're going to press start and it's going to run for 15 minutes. I'm going to start turning up the intensity. What you should feel is a strong but tolerable muscle twitch. Let me know when you start to feel it.
I'm starting to feel it.
Does it feel like a muscle twitching?
Not yet.
Any twitching?
Now I feel it. That's strong.
Is it tolerable?
Yes.
At the end of treatment, you want to make sure the current has stopped before you safely remove the electrodes. You can then collect any patient response and give them post-treatment instructions.
Alright, so we're stopping treatment. I'm going to remove the pads and check your skin. There is some slight redness where the pads were. That's normal. But if you have any blistering or anything adverse with the skin, once you get home, please call the clinic and let us know.
So hopefully now you have a better idea of the difference between high frequency and low frequency TENS, a basic understanding of pad placement and parameters to be used, and an understanding how to perform TENS treatment and what to look for after treatment is concluded.